So, as you know, the CONTACT-03 trial is a phase 3 trial that investigated the role of adding Atezolizumab to Cabozantinib in patients that have already received immunotherapy. In this trial, patients that have been treated with anti-PD-1 or anti-PD-L1 inhibitors were randomized to receive Atezolizumab plus Cabozantinib versus Cabozantinib. The primary objectives of the trial were progression-free survival and overall survival. And as you know, unfortunately, this trial was negative for both primary endpoints. In this subset analysis we have today, we are analyzing the patients that have received immunotherapy in first line, so patients treated in second line with Cabozantinib or Atezolizumab Cabozantinib. And we also investigated two different groups, patients that received immunotherapy in first line, or patients that have received immunotherapy TKI in first line. So the results were consistent among all the subgroups, and we didn't find any differences between Cabozantinib or Cabozantinib in terms of PFS or overall survival in patients that receive first-line immunotherapy combinations. When we look at the two different groups, patients that have received IO or patients that have received IO TKI, we didn't find any differences in terms of PFS, OS, and even in terms of overall response rate. And that is a little bit different to the Cabo Point trial, where we could find a difference in overall response rate in patients that have received first line with IO with an overall response rate of 41% versus patients that have received in IO TKI, where the response rate was 28%. So in conclusion, we didn't find any differences between Cabozantinib and Atezolizumab Cabozantinib in patients treated in second line, and we didn't find any differences either between patients treated in first line with IO or IO TKI.